Greetings, I'm Dr. Schiller. I want to speak in this video about optimal recovery from catastrophic and acute illness and trauma and chronic pain. My own professional background started in physical medicine rehabilitation, or physiatry, where I spent years training at the rehab hospital of Harvard Medical School called Spaulding Rehab. And we were learning to work with the complex needs of people who had just had bad stroke, spinal cord injury, brain injury, horrible flares of autoimmune disease, multiple trauma and surgery, broken bones, post-surgical complications, someone who was sick and in intensive care for weeks, and people would come profoundly impaired with all sorts of complex challenges and issues. And our job was to work with a whole team of folks, including physical therapy, occupational therapy, speech nursing, and others, to try to help that person address their overall holistic needs and functional impairment. And so I had already had a lot of exposure to natural healing methods and continued to learn about them throughout medical school and residency. And so I was looking at this population of people who frequently had exhausted the magic bullets of modern medicine with drugs and surgery, and it was just a question of, okay, how can we get the person more functional? And frequently they would continue to live and suffer with a lot of complicated chronic challenges. And so I've had this kind of almost 30 or 40 year long deep sense that there's really an intelligence, there's a healing intelligence inside you and every human being, and there's things we can do to mobilize that. And so it's not just about stopping the acute disease, but it's also about mobilizing the healing intelligence. The acute and subacute and outpatient rehab realms are important places to do all of that work, but there's much more that can be done, as I've learned over a couple of decades of incorporating a natural medicine approach together with the conventional approach to rehabilitation. So to flesh it out, I just want to share a little bit with a couple of pictures. And so, someone has an illness or injury like I talked about, and one of the prominent things is functional loss. And that's often the diagnosis that a person's working with, that they can't walk, they can't do activities of daily living. They might also have chronic pain, they might have other things going on. And so when we look at the complexity of what frequently happens, first of all, we see, of course, there's often a mental, emotional component to it. Going through a horrible illness or trauma, and then coming out significantly impaired and potentially disabled, and the humiliation and the embarrassment, shame, the difficult feelings that come on from that. But then there's biological changes, things that happen to the immune system, the way the gastrointestinal system, the immune system function, either muscle, brain, gut, nerve. There's so many things that have happened to that individual that feed into the functional loss and are fed by it, and are interacting also with the emotional mental state. And as we're going to talk about, all of these things are deeply, intimately connected. And let's not forget the fact that when this whole thing happens, it's a trauma. It's a trigger. The person's body-mind system gets this big jolt of danger signal. And that danger signal propagates through the person's system in various ways, depending on their genetics and their history and their other resources and resilience with which they can relate to that sort of calamity. But the trauma can have a significant impact on all of these systems. It can contribute to and feed into the mental emotional distress and the functional loss. And trauma can be a trigger for a lot of biological changes, as we're going to explore. Okay, so this is a picture of the gut-brain immune axis. It's from a journal from 2017. And what we're looking at here, not to get too crazy on the details, but here's your brain. Here is the gastrointestinal lining full of bacteria inside, and then outside the gut is a rich immune functioning system that is super complex. And it's a triangle, it's a three-way communication between what's going on in your brain, your degree of calm versus stress, your degree of what's the biochemistry, the neurotransmitter function, the stress function, profoundly influences the immune function, profoundly affects the gut, and it's a three-way loop of information. And you may have heard about things like the biome, which is all the bacteria that live in the gut, influencing so many medical conditions. And then the barrier function, the actual ability of the gut to maintain an appropriate degree of permeability so that nutrients can cross but bad stuff can't. And there's a huge impact from these three systems on your hormones, your nerves, your bodily structure, your body's detoxification systems, and so on. And so this stuff is a little bit on the leading edge, and it's not really making it into the standard rehab environment or even medical environment yet. But many of us have looked at the underlying physiologic principles and are doing relatively safe things to correct those underlying imbalances. So let's just unpack this some more, right? Like if you look at all the systems of your body, you've got all these different systems like digestion, defense and repair, energy, detoxification, transport. And if you went to a medical center, you'd find a different ologist who's a specialist in each of that. There's a gastroenterologist, there's a rheumatologist, there's a liver specialist, there's a cardiopulmonary doctor, there's someone who's a psychiatrist or a neurologist, there's an orthopedic surgeon to think about your structure, but who's thinking about all of it? And that's the richness of the functional integrative approach, is looking at the whole picture as one unit and finding that these things are intimately connected with each other, they're all connected to all of each other, and that they relate in various cycles. And if things are out of balance and impaired, that propagates through the system and creates other changes. And likewise, therapeutically, if we start to heal the underlying key imbalances, the system can heal much more effectively. And so don't forget the mental, emotional, spiritual, which is the core of all of this in this diagram, because what's going on in your core of your brain, that sense of am I safe, am I not safe? And even the trauma that is unconscious, that gets imprinted into your midbrain and your amygdala that you might not even be aware of, influencing all of these other systems and affecting things like how your body produces energy, how your immune system functions, your gastrointestinal, your thinking, your sleeping, your neuromuscular functioning if you're trying to recover strength after an injury. And so at the core are all these physiological imbalances. And then there's the things that they can cause or contribute to, which are all these different disease states and different kinds of bodily or organ impairments. And, you know, we call in the ologist of various sorts, whether it's be the neurologist or the rheumatologist or the GI doctor, and they come and comment and treat that particular kind of problem, but they're often not looking at the underlying interaction of all the different factors. And so that's the process that I lead my patients through, to try to understand, okay, so thinking from a mainstream rehab situation, sure, but then look more deeply at what are these underlying physiologic things that we want to correct so that the person can heal more quickly, recover their functional status, suffer less, and all that good stuff. Get back to life, you know, like live a meaningful life again. And so, you know, the way I like to explain it is it kind of like all these different things are like vicious cycles rolling downstream. And what we're trying to do with the functional and integrative approach is reverse those cycles, to actually unwind that circle, to peel off layers bit by bit so that the system can actually heal. Okay, so this is a ton of stuff. It's like an overwhelming amount of information. I like to break it down, and I just created this model that I call the 3 M's. And the 3 M's are your mind, your movement system, and your metabolic system. And of course, these are all intimately connected with each other. You know, loosely defined, your mind is all your mind-body relationships and your emotional state. Your movement system is your muscles, bones, joints, nerves, all of that. And your metabolism is your kind of biochemical system. These aren't separate, but we're kind of separating them because they're like handles. There's ways to think about what can I do, what can you do to actually help yourself heal and empower your body to recover as best as you possibly can and get towards optimal recovery. And so there's things that we do in all these different areas. With regarding the mind, it's really about understanding. It's about playing back your narrative. It's healing the history. It's putting it in context. It's you coming up with a story whereby, you know what, I'm healing and I'm going to be a hero in my own life. I'm going to recover. And part of what I do with people is really try to understand how are they seeing themselves. And there's various tools that help put that story in context and help shift the physiology and help the biology get better. Things like healing the trauma and emotions, mindfulness training, and then personal practices like prayer and self-reflection, being connected to the community. These are profoundly important to create a system-wide biochemistry of I am safe, I can recover now. The movement system, all your mechanical structural stuff. Well, okay, so PT and OT are obvious, huge parts of that if you're recovering and you're in that rehab phase. But some physical therapists or other practitioners use really specialized manual treatment techniques that help correct physiologic and neurologic issues that not every PT and OT does. There are mindful movement practices, things like Tai Chi and yoga and Qigong and Feldenkrais, and of course aerobic exercise. And frequently, in my experience, it's a combination of these things that really facilitate the highest level of recovery. And for instance, if I'm working with someone over telemedicine, I'll help them coordinate with people where they are, or help them, how do you find a good manual physical therapist or someone to really help me get into a good exercise program? Because sometimes the mainstream path of hospital to rehab to outpatient rehab, sometimes they just like, okay, you've had your 8 weeks that the insurance company gives you, now go live with it. As opposed to, wait, no, let's heal. Let's get to optimal recovery. And there's ways to go beyond, and I've seen it hundreds of times. Doc, I've tried everything. Well, no, you didn't try everything. Try these things. And then, of course, there's your metabolic biochemical system, and your medications are part of that. The preventive medications your doctor might have prescribed. Some of those things are crucial and important. The pain medications, if that's the way you're choosing to deal with pain. But diet, nutrients, enhancing your body's detoxification pathways, doing things with food and nutrients to balance the immune system, enhance cellular energy production, sometimes getting a clearer, more subtle diagnosis of what's going on hormonally. So these are some of the different approaches that I take after meeting you and really assessing what's really going on for this person. What's the big picture, and then what's going on the inside? What are your values? What do you care about? What do you want to accomplish? How much do you want for medications versus nutrients? And how willing are you to actually go the extra yard in terms of working on these 3 areas, which are your sort of windows where you can grab onto your physiology? So my commitment is to see you as a whole person, to help you navigate the complexities of the healthcare system and your own biomechanical, biological mind-body system, and hopefully bring you to the highest level of functioning and fulfillment of what you really care about. If that sounds interesting, you can make an appointment through the office, either for telemedicine or in person if you're where I'm located physically. Or you can find more information about me and other videos that I've done on YouTube and on my Facebook page. You can look it up through my name. And I look forward to seeing you and being in touch. All the best.